Thank you, Mr. Chairman. Thanks for calling the hearing, and thank you to our witnesses for testifying today. We're very grateful for your contribution. I look forward to continuing our conversation about how we can improve the quality and reliability of our generic drug supply. This is an essential issue for our committee to examine, as many aging Americans, including over 53 million Medicare Part D enrollees, rely on at least one generic drug to treat a wide range of medical conditions. Unfortunately, the supply chain for these crucial drugs remains vulnerable to disruption, and we consistently witness issues with the quality of foreign drug products, causing key medicines to go into shortage. It's unacceptable. Every American should have access to safe and affordable generic drugs. Particularly as older adults navigate the complex, difficult health conditions that they face, they shouldn't have to cope with worsening symptoms, skipping doses, or trying to stretch medicines further because they can't afford them. This is an existential issue for a lot of older Americans and for New Yorkers. I've heard from many New Yorkers about this issue. One of my constituents from Brooklyn told me, for the past month and a half, I've been unable to receive my generic medication because of shortages. Much of my day is spent going back and forth between pharmacies and my doctor's office, playing phone tag when I should be doing my actual job. I've even had to spend money on third-party services to help me find my medication when I'm unable to. The entire process is exhausting, demoralizing, and dehumanizing. A key factor driving up these supply chain disruptions is that due to the extreme cost pressures and concentrated sourcing, key starting materials, active pharmaceutical ingredients, and finished dosage form generic drug products are increasingly made outside the United States. We've seen the number of U.S. facilities that formulate generic drugs fall by 27% since 2013, and in the same time frame, we've seen 38% decrease in the number of domestic facilities producing active pharmaceutical ingredients. In fact, 83% of the top 100 generic drugs taken by American consumers now have no U.S.-based source of API, and another 11% only have one domestic source of API. This means we increasingly depend on countries like India and China, where the industry has grown for these upstream materials that represent the most vulnerable checkpoint in the supply chain. This is particularly a problem because recent instability in geopolitics and global trade practices is compounding our already limited operational oversight and control over foreign sourcing and manufacturing of these key materials. The U.S. decline in manufacturing has not only led to a domestic job loss, but it represents the vulnerability in the supply chain and increasingly poses a risk to our nation's public health preparedness and national security. To ensure Americans have a reliable supply of safe and affordable drugs, Congress will need to work to make targeted investments in biotechnology research and infrastructure to manufacture these key ingredients in the United States. In addition, we have to examine the underlying economic dynamics in the current marketplace and adjust incentives to fix the race to the bottom problem in generic drug pricing, which can drive manufacturing outside the U.S. and cause companies to stop production of certain drugs and chemicals altogether. I look forward to hearing from our witnesses today to discuss these challenges and barriers the barriers that face this industry, and I'm eager to work with Chairman Scott and the committees of jurisdiction as we address these issues, strengthen our generic drug supply, and bolster our public health preparedness and national security.